question and answer. So we're live now on YouTube, Instagram, and Facebook Live. So if you guys have any questions, please like, invite, and share as you guys come on. Um, Please, I also want to admonish you guys. Hey, Susan, thank you. Please go to Instagram and subscribe to Medical Monday, Dr. Grace Patterson. And we're on Instagram. You know, Instagram does live, but it only stays on for about I think about 48 hours, no, 28, 24 hours. So I need you guys to please like, invite, and share as you guys come on. We're going to be doing questions and answers. And guess what? Next Monday is Christmas Eve, and I'm not going to be doing Medical Monday. And then the next Monday is going to be New Year's Eve, and I'm not going to be doing Medical Monday. So we're going to take 2 weeks off, and we'll be back after the first of the year. So please get on, like, invite, and share as you guys come on, please. Hey, Susan, Oliver McKnight. Hello. Hey, Miss Nero Benson. Thank you. Please like, invite, and share as you guys come on. I'm Dr. Grace Patterson, managing owner of Bethesda Holistic Center in Metro Detroit area of Southfield. I do concierge services, alternative medicines. We also have a visiting physician practice where we bring the doctor's office into the home for the sick, shut in, and disabled. So please like, and share. We also incorporate alternative services in all the services that we provide. And I am excited about that. We have a healing clinic that we are doing once a week. We're about to do twice a week now because we have someone that's interested in helping us. So if you know someone with the opioid epidemic that is happening, anyone that's come into our clinic or our practice, they have to be committed to being weaned off opiates. So we do a very slow wean, and we incorporate alternative modalities. One of my favorites is the infusions that we do. It's all natural, made with 12 plants. And we also, you probably seen me, I was on Channel 7. Let me tell you about that, guys, before we even get started. Let me tell you how that happened. I have been using Biomed Pharmacy in Southfield for years now, and their compounding cream for pain management is phenomenal. And so they had gave this talk lecture, and they were interviewing doctors, and they said, you may be used and you may not be used, but are you interested in doing an interview with Channel 7 with Carolyn Clifford? Hello, Carolyn Clifford, Channel 7. Thank you so much for choosing my clip. I am so honored. I just want to say this too, before I even go there, to Carolyn Clifford. I used to work out at Powerhouse Gym in Southfield, and I remember you had a personal trainer there, and I saw you and I recognized you, but I didn't want to intrude upon you because that's your personal private time. But I remember you being there at the gym working out, looking as fabulous as you are now. I'm quite sure you're still working out. But that was way back, maybe 5, 6 years ago. But thank you so much for choosing the clip for me to talk about opiate crisis and opiate management, and how the compounding pharmacy will provide additional pain management or pain relief along as we wean off the opiates. So I'm excited about that. I have posted the clip from Channel 7 on my Facebook page, personal and business. Maybe I need to, and I also posted the YouTube link. So hopefully you guys will be able to enjoy that and get some more information about that. So hey, Miss Nini Robinson, you're on Instagram, so that is so nice. Hey, Doris Eads, thank you for joining on. Tonight is going to be Ask the Doctor. So I never, I don't know if you can ask questions on Instagram. I'm not sure if you could do that. I don't know how that works. But I know you could ask questions on Facebook Live. So if you have any questions, please post them now, because that's what we're on tonight, and that's what we're going to be doing. Be mindful of the fact next Monday is Christmas Eve. I will not be on. So remember, Jesus is the reason for the season. We are planning our Christmas Eve already. We said we're going to bake cookies, have eggnog, and watch some Christmas movies. So I'm really excited about that. And then we're going to go to my mother's house, who is the Christmas day. So, hey, Jack, thank you for joining on. Please like, invite, and share as you come on. Doris, if you have any questions, that's what tonight is about. Q&A with Dr. Grace. So if you guys have any questions, oh, there I see a comment on Instagram. Hello, Miss Nini. So if you guys have any questions, I don't want to keep on asking. If you don't have any questions, I guess this will be a short Medical Monday tonight. So, hey, Linda, thank you for joining. I heard, thank you for sending me that little note. It was so funny. Maria sent me a note on Facebook today saying that they had the potluck at work. And she said she hears my little voice talking to her and she has willpower. Go, Maria. Good job. Hey, Miss Nini Robinson. Now you're on Facebook Live. Do you guys have any questions in regards to anything that you want to talk about medically related? Let's make it fun tonight. We want you guys to ask questions. Again, for the next 2 weeks, I'm taking 2 weeks off Medical Monday. I will not be on Christmas Eve or New Year's Eve. And then at the week after that, I will be back on, and hopefully with a topic of your that will be interesting for you guys. I don't know what that topic is going to be. I'm gonna take some time to pray about it and be led about it on what we're going to talk about. But also, remember we did depression and anxiety during this season. A good friend of mine's sister, who is, and I consider her a good friend too, is also in the mental health services, and they are very busy this time of the year. So be mindful not only in regards to yourselves. Please be mindful to those who are around you, and check in on them, the elderly especially. Call them, check on them, go visit them, and see how people are doing, and be mindful of those that are close to you to monitor their behavior and see how they are interacting or the lack thereof. They're isolating themselves, they're not responding to your calls or whatever the case may be. And if you're a provider under the sound of my voice, please make sure you screen for depression and anxiety during this time, because statistically, I said this on my last show, that or last broadcast, is that people who commit suicide had a doctor's visit right before committing suicide, over 50% of them. So that is very high. So those of you who are seeing patients in the month of December, November, December, January, or going into the new year, please make sure that you check on them. And there has been a lot of, I've been seeing tons and tons of postings of people losing loved ones during this time. So a lot of people call and check on them during the what we call the homegoing service or the funeral, and then after the funeral is over, no one calls and check on them. So even people that are close to me, when I'm led, I'll send them a text. Hey, how you doing? I'm just checking on you. Don't want anything, but how's it going? Because after that, people get back to their lives, and then and the person who lost someone has to get back to their lives without that person that they lost, be it mother, be it aunt, be it cousin, whatever the case may be. So please be mindful to reach out to them when a person cross your minds. Hey, Red Boo 08, thank you for joining on. This is Dr. Grace, managing owner of Bethesda Holistic Center and Everything New. I am looking for questions. Tonight is Q&A with Dr. Grace. Yes, I'm a medical doctor. I did all my training here in the Metro Detroit area. Yes, I went to Mercy College of Detroit when it was Mercy College of Detroit before it merged with U of D Mercy. I did my undergraduate studies at Wayne State University School of Medicine, my residency at Grace Family Practice. No, I did not own Grace Family Practice, but it was named Grace Family Practice. I did my family practice and residency. I did my alternative or elective classes in alternative medicine. It's always been an interest of mine, and I incorporated in my practice. I do believe synergistically, or that pharmaceuticals and natural medicine can work together. I always remember, for every pharmaceutical drug that you do take, it will deplete the body of something. I do believe that the groundwork of all sickness, infirmity, and disease has a spiritual and a mental underlying root cause. And I also believe inflammation is the source, and mucus and inflammation together is what cause sickness, infirmity, and disease. And I do believe that there is a spiritual connotation with that, one of which is top of my list, is unforgiveness. So if you're someone under the sound of my voice who is bitter or hold a grudge, I'll never forgive you kind of thing, or they did that to me and I'll never forget, and you're holding on to stuff. 9 times out of 10, you're a person that have very bad health or health challenges. So you need to learn how to forgive, and that is the beginning of all healing processes. The art of forgiveness, which I have done a video on that. Please go to YouTube, Medical Monday, Grace Patterson. There is tons of videos there. If you ever missed a video or you want to go back and review some stuff, it is there for you to do just that. Is there any questions, guys? I just feel like let me see. I don't see any questions. But tonight is Ask Dr. Grace. If you have any questions, please feel free to ask them now. We've been on for about 8 to 12 minutes now. I'm just gonna, until people start getting on and sharing and asking questions, I just wanted to let you guys know that one of the things, I'll just tell you services that we provide. Let's just start there. And before I even start, sounds like a perfect Christmas Eve. I have OCD. What can I do? Oh, you have OCD? Okay, well, first of all, why do you have OCD? And what type of obsessive compulsive disorder? Okay, so the question then becomes, why do you have it? And the only person who can answer that is you. So OCD is a neurotransmitter disorder. You probably never heard of that before, but it is. There is a chemical imbalance in your neurotransmitters in your body that cause a person to be obsessive compulsive, which is a form of anxiety, also a form of paranoia. Is a combination of anxiety and paranoia. OCD meaning want everything. It could be a whole bunch of things. Compulsive hand washing, making sure everything is clean, and all that other kind of stuff. So you need to go back to your childhood, to where you were traumatized in a particular area, which causes you to be OCD. And most oftentimes, a traumatic event has happened to a person, because to be honest with you, OCD has a strong association with post traumatic stress disorder, post PTSD. They are very close and very similar. So you need to go back and find out, why are you that way? What happened to you to trigger the thoughts where you are obsessed about whatever that you're obsessed about. And so you have to deal with that event that has happened. And so once you start dealing with that event as a child, what happens, that event triggered thoughts and triggered your body's chemistry to release certain chemicals, certain neurotransmitters that basically put an imprint in your mind, an imprint in your emotions, and an imprint in your very soul, to where you're obsessed about something. We should never be obsessed about anything. So what can you do about it? First, find out what was that traumatic event. And sometimes we can suppress things that happen to us as a small child, or not even as a small child, even as an adult. We are good at suppressing things that may have happened to us. So what first thing you would need to do is pray and ask God and say, hey, why is this happening? What happened to me to allow me to be obsessed and have this OCD? And I promise you, he will show you that very thing. And whatever that very thing is, you need to confront it head on. Be it talking into a recorder or your phone, or journaling, or writing it out. I really do believe once you write something out, especially something negative, you can get it out on paper and look at it. And then whatever happened to you, start with forgiveness, because sometimes things that happen to us happen because of something or someone has done to us. And so once we figure that out, forgive. Once we forgive, understand what it is. And then if you have a doctor, a holy basil is good to take. Yes, nerves. Yes, it is. But let me tell you, before you start taking herbs, you need to know what the deficiency is before you start taking herbs. Because I posted this one time before that herbs and supplements, if not taken properly, which means understanding the root cause, is just like taking a pharmaceutical drug, which is just treating a symptom. So a person that has OCD, their neurotransmitters are off, are imbalanced, I should say, and we need to find out why they're imbalanced. So we're talking about from the emotional, spiritual, because I believe being healthy from the inside out. So we have to address the emotional and then spiritual part of it, and then we got to find out what you're deficient in. So once those neurotransmitters are imbalanced, there is a deficiency that has taken place that won't allow them to go back to be balanced. So at Bethesda Holistic Center, that's what we pride ourselves on, what we call health mapping. Where are you right now as far as the imbalance is, which causes the OCD, and what do we need to do to get you balanced so your body can auto correct itself so you can function without the OCD. Okay, so and being that we use natural modalities, I'm very careful with my words because the Food, Drug, and Administration and laws forbid us from saying that natural remedies and herbs actually treat or cure. But I can say that it can put your body in a homeostatic or homeostasis where it can auto correct itself, where your neurotransmitters are balanced so you won't have to deal with that OCD. So that is my recommendation, is to pray and ask God to show you what traumatic event that has happened, or any, and to deal with that, journal it out, write it out. Sometimes what you can do is write it out, read over it, get scriptures that is in regards to that. One of my favorite scripture books is called A Promise Book. A Promise Book was just scriptures where it tells each category of things that a person may be dealing with: anger, impulsive thinking, anxiety, depression, and financial situations. Those promise books have scriptures that address those, each and every one of those areas, but do the same thing with that traumatic event that may have happened to you, and start focusing on that. If you understand, and also catalog the thoughts that you're having during the from the OCD. So what is it? I'm gonna use this as an example. OCD. I forgot to lock the door. So a person that has OCD may check that door 100 times. So why is it that a person is so obsessed about whether or not the door is locked? Was there a break-in? Was there a robbery? Was there an assault of some sort? So you need to address those type of things again. And then again, like I said, reach out to Everything New and find out what your deficiencies are so we can get your neurotransmitters in a homeostatic state, so you won't have to, so your body can auto correct itself and get those neurotransmitters balanced. And then once you get them balanced, then the herbs that were recommended on the comment section would be a maintenance, right? I prefer for herbs and supplements to be a maintenance and not something that's treating a symptom. So there's no difference from a herb or supplement. If you don't find the root cause, it's no different than a pharmaceutical drug. So hopefully that makes sense to you. Holy basil is good. Yes, it is. And not only to take orally, holy basil is very good as a tea. Basil is very good in your food. You can cook with it. It can come in a capsule form. So yes, I really do believe in that. So very good. It says, thank you, Dr. Patterson. You're a blessing. You're welcome. Hi, Pastor Flynn Choi. Thank you for joining on. Please like, invite, and share. Hey, DeQuinder. Thank you for joining on. Thank you. Thank you. Thank you. Hey, Mona. Thank you for joining on. Is there any other questions? Let me scroll back and make sure I haven't missed any questions. That I only got one question. But anyway, so let me tell you, I talked about the health mapping, finding out the root cause, finding out the deficiency. It is amazing how a traumatic event can shock the body and deplete the body of something, because it's like like I use this analogy all the time. You're like in a boat with a hole in it and the water is gushing in, and you have a pot and you're taking the pot pouring out the water. But when you find out what the root cause is, you're patching the hole. You patch the hole so the water stop gushing in, and you can use the pot to pour out the water so the boat can stay afloat. So please, that is what I recommend for anything or anyone or any emotional or mental situation that anyone that may be dealing with. So OCD. So you have to do self-talk after we find out all of that. You also have to, because now it's a habit. So now you have to get in a situation where you break that habit. When those thoughts come, what do you do? You have to self-talk to yourself. Okay, I already checked the door. I don't need to go check it again. That kind of thing. And knowing the word of God is very important. God has not given me a spirit of fear, but of love, power, and a sound mind. So you need to know the word of God, and not only and just positive confessions. you know um I trust the environment that I'm in. I trust the locks that are on the door. I trust and believe God that when He said that He will protect me and keep me, He never leave me or nor forsake me. So all those things that you have to actually confess them and think them, because so as a man thinketh, so is he. And life and death is in the power of the tongue. So you have, and there that speak eat the fruit thereof. So if you're speaking positive things, you will eat the fruit of positive things. So it's a combination approach. It's just not one thing. And then, like I said, the basil will be a maintenance once we figure all that out to keep you calm. Yes. Is there any other questions? Let me see. I'm scrolling down. What causes fluid on the brain? Oh, it could be a whole bunch of stuff in regards to fluid on the brain. It can be what we call encephalitis. Some people can be born that way. It could be viruses. There are different type of viruses that can cause fluid on the brain. It can be trauma that cause fluid on the brain. People hitting someone in the head that will cause an intracranial bleed. It could be trauma, viruses, bacteria can cause fluid on the brain. Like I said, people being born that way, that have cerebral palsy, that have fluid on the brain, or hydrocephalus. And then sometimes people have to get shunts in their head that drain into their tummy, that will cause fluid. So it could be a whole bunch of things that cause it. But most oftentimes, if a person is not born that way, it could be from, like I said, some type of inflamed process due to some type of infection, be it viral or bacterial. So hopefully that answers your question. So, like I said, it could be a whole bunch of different reasons. A stroke cause fluid on the brain, a swelling of the brain. Most oftentimes, like I said, trauma, somebody hitting their head, car accidents, assaults, those things can cause fluid on the brain. So it could be a whole bunch of things that can cause fluid on the brain. So hopefully to answer your question. Hello, Dr. Grace, is CBD oils safe for arthritis? CBD oil is safe for a whole lot of things. It could be for arthritis. It could be for people that have any type of neurodegenerative disease, be it cerebral palsy, be it seizures, be it multiple sclerosis. A lot of people have their input and say about certain things in regards to medical marijuana or CBD oil, which is a form of marijuana with the THC being removed. And what is THC? THC is what gives the highness and the euphoria to the medication that you may take. CBD oil can be used topically. There is a lot of places now, since it's now been made legal and in a recreational sense, um, um, that people can use it. I've seen it in my where I go get my juice now. I juice. I don't want to give anybody any free advertisement, but they do they call cold press juicing, and they're adding CBD oil to some of their juices now. It's all everywhere, and you still have to be careful. And then one of the things that I have heard too, a question that I often get, even with pain management, or ours is called Healing Clinic. Now that marijuana is now recreational, how does that affect the patients that come or part of the practice? We still have rules and regulations that govern our clinics. And our clinic is, if you're going to use a medical marijuana, you have to have a card. And if you violate that, even recreationally at our practice, you're in violation. So you have to get a card for that. Um, a lot of people feel that that, how can I say this? That is an illicit substance, that is a drug, and that people should not be on it. But I really do, for medicinal purposes, for people who really truly need it, I do believe it. I prefer that than an opiate, and I've said that before, and it is my medical opinion, um, that I would prefer someone to be on medical marijuana versus an opiate, okay? And I would prefer for it to either be in hemp form, removal of the THC or the high euphoria part of it, for medicinal reasons, for people to have relief from pain, or release of seizures or tremors, or slowing the progression of any neurodegenerative demyelinating disease. I do believe that there's benefits in that. I don't really think that it has to be smoked, because it comes in different forms. There are edibles, there's oils, and there's topicals. So, do I want my 83-year-old mom on medical marijuana with THC? No, I do not. And the reason I don't want her on that, because it has euphoria, number one. Number two, there is already balance issues. So if you're causing someone to be high and out of it, you're increasing their risk of falling. So, is it safe? I just wanted to say it depends on the situation and the scenario. And always remember this, when I do respond to your questions, it's a blanket statement, because I don't know the whole history, the background, and the person that you might be asking for. I don't know all the details to it. But at the same time, anything that you use for medicinal purposes or recreationally has to be used with responsibility. With this recreational now being legal product, now there's going to be ramifications of it, just like alcohol, right? Just like prohibition, alcohol was illegal for years, decades, and then it became legal, but it's still the number one killer in our society, because it causes problems, cause cirrhosis of the liver, cause liver damage, and it causes problems with people driving drunk. We still have people that are being killed by drunk drivers, and that people are still getting behind the wheel intoxicated, and they're expecting the same with recreational recreational marijuana. They're expecting the same, that people are going to get behind the wheel irresponsible to their recreational use of the substance, and cause bodily harm to others. So, as a part of combating that situation, part of the talks in regards to that is that we can expect an increased rate in our insurance rates in the state of Michigan. So even though it may help bring in revenue to our states for tax purposes, roads, and all that other kind of stuff, and what is it going to do in regards to our purchasing power for for auto insurance and things of that nature? So there's, I know I said a lot. CBD oil is safe for arthritis, so I know I said a lot. So CBD oil, being for arthritis, as long as it's locally, not systemically, because it's going to go directly to that area. So being that any compounding substance or topical, it goes directly to the area, there is less sedative, or should I say mind altering effects of it in the elderly when it goes on topically. So it can be safe. But as far as any other way of modality of being smoked or being taken orally, it can cause some mind altering things, which we do not want. So just take that in consideration. True story. I have someone that's in my healing clinic that I just saw a couple of weeks ago. We're getting his he was getting his pain managed. We were weaning him off opiates. He decided to get a medical marijuana card, and he started smoking. So I'm like, okay, so every time he comes, he's 10 pounds heavier, 15 pounds heavier, 30 pounds heavier. I'm like, okay, what is now? His pain is getting worse because now he's heavier because he has to carry the weight on the joints that he has problems with, his lower back. He's getting truncal obesity and stuff like that. And so I'm like, well, how are you taking your medical marijuana? He said, I'm smoking. I said, well, one of the side effects of smoking is munchies, right? I said, so you're eating up everything. So you're defeating the purpose. I said, so there is other ways that you can do. I prefer if you do it hemp THC without the THC, or do something topically, because now you were losing weight and feeling better. Now you done gained all the weight back because you're smoking and you got the munchies. So so there is things that we have to take in consideration as providers. If we want to certify someone for medical marijuana, you have to educate them and have to say we need to try something a little bit different. And he was agreeable to that because he's like, I don't like the way my clothes fitting. I don't like the way my lower back is hurting. I don't like the way my knees are hurting. That's what all the things that he was saying. So we had to go back to his health map and take another a route and go into another direction. So hopefully that answer your. Hey Dion, thank you for joining on. Please like, invite, and share as you come on. Hey Gwendolyn. Hey, what's that? Gwendolyn. Brandon Johnson. Please like, invite, and share as you guys come on. Is there anyone that has any more questions? I'm trying to read. Hi, Dr. Grace. Oh, you're from Lincoln Park. Oh, all right. Thank you for joining on. Is there any other questions that anyone might have? It is 8:33. Does anyone have any other questions that I can address? Tonight is Q&A with Dr. Grace. Um, I saw someone say, "How do you get fluid on the brain?" I think we addressed all of that. Is there any other questions as we go on? So, as people, are you any questions that you might have? I just want to let you know that we're going to be offering sleep study tests coming January 1. So I did a whole talk on how to sleep properly. So please, these 2 weeks that we're off, please go to my YouTube channel, which is Medical Monday Grace Patterson, and look on how to sleep properly. And also, we did a talk on a video on a show on sleep apnea. We're going to be able to provide that testing, and it can be done in the home. Guess what? Years there are some places where you have to go into a sleep study lab, which means that you have to pack an overnight bag, leave your home, and actually have a sleep study test done in a facility. But now they're being with technology, thank God for technology, it can be done in the privacy of your own home, in your own bed, where you don't have to leave. And we come and set you up. It's just like those gargles that people wear virtually, but it goes across your head. You have a cannula that goes in your nose. That my sleep pattern is all messed up. Hey, Michael Murphy. So you probably need to have a sleep study test to find out why your sleep pattern is so messed up. You definitely have to make sure that you have good restful sleep. And we even did a talk on that. We even have products that is called sleep support, sleep brain support. So if your body is not getting the sleep that it needs, you can't function, you can't think properly, you get cloggy thinking, your neurotransmitters are definitely off. If you can't sleep properly, you can have daytime sleepiness, and the less you sleep, the more you eat. Most people that have sleep problems or sleep too much or not enough have problems with releasing the weight like they should. They're not weight well, what you call weight wellness. So come January 1, we're going to have sleep studies tests that for Medicare patients, they do will cover that. Some commercial insurances, and for those of you who don't have insurances, we're going to make it affordable for you to pay cash for the test. So it is very, very important that you get this done to find out if there is a problem while you're sleeping, because sleep apnea can be the source of cardiac disease or cardiac problems. High blood pressure can cause cardiac problems because a person, and what we call brain death, because when a person has sleep apnea, they actually stop breathing and it decreases oxygenation throughout the whole body, which can cause tissue damage to the brain. So, and to other parts of your body as well, heart, kidneys, lungs, the whole gamut. So I'm looking forward to that. DeQuinta says, what do you recommend for hair growth? Again, why is the hair coming out? So we need to address what's going on there. Is traction alopecia, all the weaves and the tight braids. First of all, we need to stop that. Is it because of a hormonal imbalance, or what's going on there? Is it a neurotransmitter imbalance? I remember my hair was coming out really, really bad at one point due to my cortisol levels being very, very high. Believe it or not, cortisol is the only neurotransmitter or hormone, whichever you want to call it, that increases with increased age, and it can cause hair to come out. Is a person having hair loss because of hypothyroidism, because their thyroid is not functioning like it should? So all those things. So the reason is, why is the hair coming out? So I've had a stylist, a few stylists that came to see me, and we're doing what we call platelet replacement therapy. And what we do, we actually draw the blood, spin it down, take off the platelets, and put it in the area of hair loss. But at the same time, before we do that, we see if there's any deficiencies or imbalances, because we can get the hair to grow, but if we never correct the reason why it fell out in the first place, we can get it to grow, or they'll fall out again. So we just don't promote getting your hair to grow and not finding out the reason why it fell out in the first place. So that's what I recommend. What do you do to recommend for hair growth? That is what I recommend. I love biotin. We pride ourselves on coming up with an infusion and or IM injections of biotin that goes in the hip, because if you take biotin supplements, you don't know how many milligrams that you're really getting, because biotin is a vitamin, and it's not FDA regulated, so it can have the milligram dose on it, and even if it does have the correct milligram dose on it, you have to swallow it. It has to be broken down in the stomach. Once it's broken down in the stomach, it has to go to the GI tract, through the GI tract, which is the gastrointestinal tract, which is your gut. It has to go to the blood system, go through the blood system, and hit those follicles. And then once it hit those follicles, then we don't know how much milligrams is really getting to the follicle. But IM injections or intramuscular injections bypass the GI tract. So whatever milligram dose we put in there. Thank you, Michael. What age are you? You look great. Oh, thank you for asking. I do anti-aging medicine. I am 51. I'm soon to be 52. I am a GMA. I have a granddaughter. Yes. So yes, I have an adult daughter. Yes, I do. So yes, thank you so much. What I get on here and tell you guys, I put into practice. Hey, Larry, thank you for joining on. Is seizures hereditary? That's a good question. Seizures can be hereditary. It could be due to a gene deficiency, or it could be something that, or what they call idiopathic. Seizures can just happen randomly, and they don't know the reason why. It's because we're not trained to find out the root cause or check for neurotransmitters, because that's the nervous system. And we're just, as physicians, we see seizures, so we just prescribe anti-seizure medication. And so as a anti-aging or integrative medicine practitioner, if you're someone under the sound of my voice who have been to doctors and they can't find out what's going on with you is not because that they don't want to find out what's wrong with you. It has a lot to do with our medical school training. So if you're someone under the sound of my voice that's tired of going from place to place and they're just giving you medications without finding the root cause, we are the practice for you. And so please give us a call at 248-356-1111 or go visit us at our website, www.bw-center.com. That's 248-356-1111. And if you're a practitioner and you're like, I am tired of practicing the way that I have been practicing, it just feels like I'm just putting a band-aid on everything. And the more medications that I give my patients as a provider, it just seems like they're getting worse because there's more interactions. It has to be a better way. If you are interested in learning how to treat patients based upon biochemical physiology, you need to connect with us as well, because we're going to have a training that's coming up as early as the first quarter of next year for providers who are interested in saying, hey, this is not what I want to do. I want to do better by my patients. And how about you want to do better by your own health? And so, yes, seizures, to answer your questions, it can be hereditary. It can be idiopathic, just start from nowhere. It can be post-stroke or what we call a cerebral vascular incident. It can be after someone had been in a car accident, had some type of head trauma. As far as heredity is concerned, that which means it is a genetic predisposition for someone to have seizures because someone in their family prior to them have had it. Yes, that could be possibly it. And the spiritual side of that, we call that a generational curse. So is there any other questions? Please like, invite, and share as you guys come on. Again, getting back to, I was able to answer that. So hopefully I can get back to talking about some other things. Sanitra, hey, can you prevent dementia and Alzheimer's disease? You sure can. You can put your body in a homeostatic state to where you decrease inflammation of the brain by getting the appropriate sleep, eating the appropriate foods, making sure that you do all the things that you need to do to keep the inflammation in the body down, as far as what you put in here to help you with that. There are certain substances that cause Alzheimer's disease, which is called amyloid, which is a sticky protein that sticks to the cells that are in the brain, that's supposed to be cleared out nightly by getting an appropriate amount of sleep. And if you're not getting an appropriate amount of sleep, the right type of sleep, you don't clear that protein out and it becomes a buildup, and then that can cause Alzheimer's disease later on in life. There's also has been a strong association with Alzheimer's disease and poor dental hygiene. So think about it. If your mouth is infected, if you have periodontal disease, your mouth is very close to your brain. So that's why even if someone has periodontal disease or mouth abscess, it's very important that you treat that very aggressively. So because it's close to the brain. Dementia, people should do word puzzles, crossword puzzles, all those type of things to keep the brain active. And also you need to quiet the brain. I do believe in meditation. I really do believe in the power of prayer. As you pray, you should, to me, prayer is a two-way street. Once you pray, you need to quiet yourself so you can hear from God and quiet your brain and let it get a rest too. Because your brain is a muscle, just like, well, it's not made of muscle tissue, but as we exercise and use our brain, we need to rest it as well. So I do believe there are some things that you can do to make sure that disease doesn't settle in your nervous system. Yes, I do believe there's things that you can do to detour or not allow your brain to get into that situation where it can be an open door for dementia and Alzheimer's disease to manifest later on in life. There is some genetic things that can also cause a person to have an earlier onset of Alzheimer's disease. So there's some genetic testing that you can get done if you want to. There's some geneticists out there that can do that for you, if that's something that you're interested in. I do believe in the power of turmeric. I do believe in the power of curcumin. I do believe in the power of any good anti-inflammatory that we do. We have anti-inflammatory infusions that we give our patients, not only for pain management, but also to keep the pain levels down. How many of you out there have seen or have heard someone that's athletic that eat right, runs, and all of a sudden they just drop dead of a stroke or a heart attack? And it's like, what, they were doing all the right things. If you're someone under the sound of my voice that knows someone that happened to, and you're very athletic and you're, no pain, no gain, as they say with working out, um, of course, there's no pain, no gain with no pain, but at the same time, you have to address the inflammation that happens when a person works out. And it is very, very important that you do that, because exercise does cause an inflammatory state in the body, and it needs to be addressed. So that's why fish oil is very important. Flaxseed is very important, not only for inflammation for the body, but also for the brain. Fish oil is very, very important for that. Um, like I said, we have this anti-inflammatory. I'm getting my infusion tomorrow. I forgot to. I was planning on doing it today, but I'm gonna definitely get mine tomorrow, because I do work out. I'm gonna work out tomorrow. I'm gonna do my weight training in the morning, and I plan to do my own, get my own infusion tomorrow, because I need to control the inflammation that is in my body. You can. There are certain foods that increase inflammation in the body, which increases the risk of Alzheimer's disease and dementia, and that is processed foods and fast foods. So it everything in regards to being healthy and prevent, as far as being healthy and minimizing diseases coming into your life and affecting your livelihood, your life, and your lifespan, starts with what you put in here. And yes, and not only what you put in here, what you speak out of here too as well. So you have to be a positive person, and your thinking too. Stinking thinking cause inflammation. So you have to make sure that you are emotionally set and stable. And so emotional hurt and pain can also cause the body to hurt and cause an inflammatory state. So there's more to it than just exercise, diet, but I hate that word, food choices, and the things that how we think and how we manage our lives overall, as far as stress management and all of that, it goes together. So hopefully that answered your question. What are normal liver enzyme levels and numbers? Okay, so let me tell you something about reference ranges. I just did a study in anti-aging. You got to understand what reference ranges are. Reference range is this equation that the lab and a laboratory or the medical field or profession came up with, that says if your enzyme levels or whatever your levels are fall within this range, that's normal. But guess what? It may not be normal for you. That those ranges are not for optimal health for an individual. It's a statistic value or statistical range that they came up with, that is a reference range to tell people, if you fall within this, then you're okay. So it is not an indication of optimal health or optimizing your physiology for you as an individual, or your body functions for you. So there are different type of liver enzymes. So, and it could be your AST, or your alkaline phosphatase. There's different levels for that. So, so the reference range on that. That's why it's important for people to do the health mapping, so we can figure out what is optimal for an individual, not based upon a reference range that's been statistically designed for the general public, I should say, or the general medical community, or patients. Should we drink warm water versus cold water? Believe it or not, The question then becomes, should we even have refrigerators? Should we even have preservatives in our food? We can take it off, um, um, even further than that. It's depending on what you read versus cold water versus warm water. Um, even in nature, when you're out and about, a brook can be cool and be cool water. You can drink from that. Versus warm water, your body temperature water. It all depends on what you read. I do believe that at room temperature, especially in first thing in the morning, is very good in the morning. Cold water is basically based on preference. Most people drink cold water after working out or exercising because it brings the body temperature down. So it all depends on what you read. Any hydration is very cold water versus warm water is just getting people to drink water, period. So versus being cold or warm, the temperature to me doesn't even matter. What matters to me that people actually drink it and drink the correct amount. So those, oh, Beverly, thank you for being on. I thank you for your question. Please like, invite, and share this video with someone. So what we do here at Bethesda Holistic Center, we tell people the correct amount of ounces that they should drink. So it should be your body weight divided by 2.2. That's how many ounces a day that you should drink, ounces that you should drink per day. An average size water bottle is 16.9 ounces. So you can divide that number by that 16.9 and it tells you how many bottles that you should be drinking a day. Or if your water jug is 20 ounces, you divide that number by 20 ounces so that whatever that 20 ounce container is, that's how many you should be drinking a day. I get what type of waters that you should drink. I do believe in alkaline water, but I don't believe it should be drinking all the time. You should only drink alkaline water when between meals, because God created your body or your tummy to have a low pH to break down the food and the bacteria. So alkaline water has a high pH, so you should not be drinking alkaline water with your meals. Is coffee good for healing for the liver? Coffee is good for a whole bunch of stuff. Let me take a swig on that. Yes, I love coffee. Every year there's a different um, medical something. Coffee is good for you this year. Next year may be bad for you. This year may be good for you. Then the next year may be bad for you. But coffee is the highest. I remember asking someone, what is the greatest traded commodity in the world? And it's coffee. It's a multi-billion dollar industry, and it's the cocoa bean. So it's coffee, 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 coffee. Um, the coffee bean, not the cocoa bean, but the coffee bean. I do believe in medicinal purposes of coffee. Coffee enemas are good. I do believe in coffee in as far as the antioxidants that it can have. I also drink green tea. Um, Caffeine versus not having caffeine. If you're someone under the sound of my voice that have hypertensive issues, you need to be not drinking caffeinated coffee, because it will cause your person's blood pressure to rise because of the caffeine that is in it. So you got to be very careful and mindful of that. If you're someone under the sound of my voice that is maturing as a woman, and you're dealing with hormonal imbalances, and sometimes you may flash, caffeine and coffee will cause you to flash. So you have to be mindful of that, especially if you're not hormonally balanced. Coffee is a trigger for hot flashes. So is coffee good for healing the liver? Coffee is good, has a lot of medicinal purposes, not only for the liver, but it also can be a natural appetite suppressant, along with green tea extract. Both of those are good and a good antioxidant. I do believe in good coffees. You have to be careful. I do believe you have to get a good brand of coffee, and you got to understand what is processed and all that other kind of stuff versus what they're doing to it and all that other kind of stuff. So I do believe I love Isogenics coffee. I love that coffee. And some other coffees that I drink. I love coffees that have flavor. I'm now trying to drink my coffee black. I'm trying to get away from dairy a little bit, and I'm excited about that. I still got to be careful because I'm still trying to work on my teeth, and I don't want the coffee to restain my teeth. I've been really working on my teeth. I really should be drinking my coffee with a straw, but that's a whole nother story. So yes, I do believe in coffee is good healing for a whole lot of stuff. Hey Janet, please like and invite and share as you come on. Hey Jonah. Hey Jonah, how are you? Please like, invite, and share. Tonight is questions and Q&A with Dr. Grace. Was there anyone else that have any other questions while you're on? I'm trying to see if anybody asked anything anywhere. Oh, I just saw it. Hold on, let me see what that says. Somebody asked me something else. Am I getting top chat? Okay, let me see what we got going on here. Are you getting my questions? No, I see it now. I have winter sinuses. What do you suggest? Okay, well, first of all, why do you have winter sinuses? Do you get them every year? So the questions, it can be environmental, it can be things that you eat. I tell people if you have sinuses that are really, really bad, dairy is the culprit. We were not designed to eat another mammal's milk, and cheese is one of them. I love cheese, but I'm trying to do the vegetarian cheese. But if you can get away from the dairy products, that would help. If you orange juice or anything that has citric acid in it increases your mucus production. So if you're drinking orange juice for the vitamin C, I would prefer if you just take vitamin C. I need to know why you have sinuses every year. One of the things that I like that I use around this time of year to build your immune system up, because sinus problems is a clear indication of a poor immune system. So I do believe in vitamin E, vitamin C. I love oil of oregano. I actually make some in a carrier of olive oil, and I do believe in silver. Silver helps build that up, and vitamin D. I do 50,000 IUs of vitamin D a week. If I feel that I'm getting congested or anything like that, I do that. Another thing that I do, I chew cloves of garlic. I know it can leave your breath on bumpty diddy bump, but brushing and oral hygiene is very important. That when you do that, and garlic itself is a natural antiviral and a natural antibiotic. So I do believe in that, and that will help with your congestion. Silver, you can buy. I have some, so if you want to get it from us, that'll be great. I know some of you are what I call snatch and grabbers. And what does that mean? You get all the information that you want from us, and then you go somewhere and support something else. But you know what? I like giving information to help people, but at the same time, there should be some type of reciprocity. So we do. All silvers are not created equal. You got to be careful for ordering things online, because most natural products are not FDA regulated. So what we do here at Bethesda Holistic Center, we make sure whatever product that we promote or advise that you get is vetted, and it is researched and is used by yours truly before I recommend it. So I take all the worry out of, oh, if my God, if I get this, is this really what it says that it is? So I guess to pour out the eggnog, yeah, I guess you should. Are you getting my questions? I have sinuses. What do I do? Very good flow of good information. Thank you, Dr. Grace. Hey, Phyllis Anderson. Thank you so much. What do you suggest for sleep driving? It sounds like you have sleep apnea, Carl. If you're sleep driving, that means you're not night sleeping. So you probably need to get a sleep study done. You might need a CPAP machine. I recommend that you get some good sleep so you won't be sleep driving. I think that's it. It's 9:00. That time went by really fast. I just want to make sure I got all the questions answered that that people asked. I really appreciate you guys tuning in. Please like and invite and share this video. Okay, for the next 2 weeks, I'm taking 2 weeks off of Medical Monday. Next week will be Christmas Eve. So enjoy your family. Please enjoy your family. And the next one after that is New Year's Eve. And then the next one after that, I think that's going to be January the 8th or the 9th. No, I can't do my math right now. But the Monday after the 31st, I will be back on Medical Monday. How about that? So please like, invite, and share as you guys come on. I don't know what my topic of discussion will be. I will post it on Medical Monday Facebook. I might come on and say hello. Of course, I try to post pictures of myself and my family during the holiday season. I really do appreciate you guys supporting Medical Monday. I really appreciate you guys coming on. Please, if you're someone under the sound of my voice on Facebook Live, go to YouTube and subscribe to Medical Monday Grace Patterson, and please share this with other people. Again, this is Dr. Grace Patterson, managing owner of Bethesda Holistic Center and Everything New Medical Center, where we do alternative medicine and concierge services, where we bring the doctor's practice into your home. We do healing clinics where we pride ourselves in weaning people off opiates and introducing them to other modalities and managing their pain. We are looking for new patients now. I have help. Thank you, Jesus. I have help. But if you're someone under the sound of my voice who is not serious getting off opiates, we're not the practice for you. Let me say that again. If you're someone under the sound of my voice who's not serious about getting off opiates, we're not the practice for you. We want people off the opiates. We want people to understand that, opiates is a crisis right now, and people are dying and ODing on it. We're trying to get people off of it and to live a close to pain free as much as possible by treating you as a human being first, and treating you're beyond your pain. You're not your pain. Your pain is not you, but giving you the tools that you need to live a healthy, productive life in all areas of your life. And prosperity is not always about money. It's about your health, because you can have someone that's prosperous and have a whole lot of money and don't have their health. They will say that they would trade in all their money to at least have their health. So thank you so much for tuning in. Enjoy the holiday. Jesus is the reason for the season. Merry Christmas, and have a blessed and prosperous new year. Remember, have a plan when you're eating during the season, okay? I went to a Christmas party yesterday at Impact Network. Hey, Grace and Peace, Apostle and Dr. Beverly, and I ate my meals off little saucers. And even though I'm not eating meat right now, the stuff that they had, the green beans and salad and all of that, I did have a cupcake, but I just had one cupcake. And I still have to be careful with that. And I have to be careful in what choices that I make in regards to even my beverages. So I drink water. I try not to drink any of the sweet things that they have to drink, because I redirect my calories. So come up with a plan on what you're going to do in regards to your health. Please, and buy someone a health gift. Buy yourself something in regards to your health for yourself for the holiday season. I know a lot of people are like, I'm going to do whatever I want, and come January 1st, then I'm going to get on the wagon. No, you need to stay on the wagon all the time, because any slip and dip is a regression, and it can cause some irreversible damage by the choices that you make. So make good choices at all times. With every choice that you make every day is a life or death choice in regards to your health, believe that or not. So thank you so much, and I appreciate you. So grace and peace. God bless. Bye for now.